The pandemic brought a lot of things to light over the last year and a half. COVID-19 showed us that people with heart disease are at a higher risk of complications if they contract the virus. Some people are still anxious about leaving home, even to see their doctor. But delay in care can lead to long-term health consequences, especially when it comes to your heart. Today is World Heart Day, so we're going to talk about why protecting your heart is more important than ever. I'm happy to be joined tonight by Jen Rager with Mercy Health to talk about heart health. Jen, thank you so much for taking the time to talk with us tonight.
Thank you. I'm happy to be here. Thanks for having me.
Of course. So let's jump right into it. What is World Heart Day, and how can people be sure to care for their hearts today and every day?
So World Heart Day is really just a day to focus on awareness and prevention and management of cardiovascular disease, because it is the #1 killer of Americans. Cardiovascular disease kills more people than all forms of cancer combined. So two things that you can do to really focus in on celebrating, I guess, World Heart Day is to make sure that you schedule your doctor visits. Whether you have a heart condition already, make sure you're following up with that heart doctor and getting your checkups like you should be, or just seeing your regular doctor, whether it's your family doctor or if you have other conditions, following up on those to make sure it doesn't lead to other conditions. And number 2 would be getting the COVID-19 vaccine, because it has been proven in the trials that people with cardiovascular problems are at a higher risk for bad outcomes with COVID-19.
Speaking of COVID-19, what are healthcare workers experiencing when it comes to the pandemic and its effects on heart disease?
So a lot of people are very hesitant, number 1, to go to the doctor and just resume their normal, regular, annual, or follow-up checkups, number 1. They're not wanting to make those appointments and just go to any type of healthcare facility or doctor's office. So they're not engaging in their normal routine care. And then they also then aren't necessarily taking their medications like they should be. So if they run out of a medication, sometimes they just stop taking it, which then leads to even more serious problems. And then ultimately, usually a hospitalization, when that could have all been prevented by just going to your regular checkup. So we're seeing just kind of a chain reaction by people being nervous about going to the doctor, which it's perfectly safe to go to the doctor. It's perfectly safe to go to your routine checkups. There's no harm in going to your doctor's offices and seeing the staff there. It's no worse than, going out to anywhere else, to the grocery store or anything like that. It might even be safer than that.
One final question before we let you go tonight. What communities are seeing the highest rates of COVID-19 and why?
I would say they would be the people in the more poverty areas and the low income areas, and also the more rural communities, because they tend not to be vaccinated, number 1, and they also tend to have also the more essential worker jobs. So they have to go to work and they don't have time to really, those are the people that tend to not take care of themselves, if you will, lack for a better term. So we do see a lot of issues with that population. The Black, Latino, Native American population, those kind of communities also we see a lot of illness with them. So we try to get education out to them. We have a community health department that visits those communities quite frequently to try to get education out to them.
Jen, thank you so much again for taking the time to talk with us about heart health today, especially because it is World Heart Day and the importance of it as the pandemic continues. We appreciate it.
Absolutely. Thank you.
Thank you so much.